Today, there are 23 new cases of COVID-19 in New Brunswick. That is the greatest number of cases public health has reported in a single day since the COVID-19 pandemic was declared last March. And as I mentioned earlier, what we're seeing across the country, what we're seeing in the US, in Maine, and also in parts of Europe and the UK, and globally, daily numbers of record-breaking cases announced every day, record-breaking number of deaths every day. This is a worldwide issue right now that New Brunswick is not immune to. The cases are as follows. In Zone 2, which is the St. John, Kings, and Charlotte County areas, there are 16 cases. 2 individuals under the age of 19, 3 aged 20 to 29, 1 aged 30 to 39, 5 aged 40 to 49, 2 aged 50 to 59, 1 aged 60 to 69, and 2 aged 80 to 89. In Zone 1, which is the Moncton region, there are 6 new cases, 1 under the age of 19, 1 aged 20 to 29, 3 aged 30 to 39, and 1 aged 60 to 69. In Zone 3, which is Fredericton and Central New Brunswick, 1 case, an individual aged 30 to 39. There are now 71 active cases in New Brunswick, with 1 individual in hospital. And I ask that you keep these fellow New Brunswickers in your thoughts and prayers today, as well as the very large number of people who are self-isolating at home for the next 14 days, worrying and wondering if they are going to become COVID-19 positive as well. We are closely monitoring the situation at the Shannock's Parkland Adult Residential Facility in St. John, where 1 case of COVID-19 was reported this week. Yesterday, 421 tests were administered and 3 new cases of COVID-19, all in the same area as the original exposure. So further processing and analysis will continue today. This facility has single rooms and a separate wing for Alzheimer's patients, which is helpful in slowing the spread of the disease. We are continuing to test all residents and staff at the complex and are taking all other necessary steps to prevent further spread of COVID-19 among the residents. We are facing a serious situation with the renewed transmission of the virus in New Brunswick, and honestly, I know this is a direct relationship between what's happening in our province and what's happening across the country and other jurisdictions in terms of the record number of increasing cases across Canada, in the US, globally, and the UK and Europe. So our situation can turn quickly very serious if we do not take immediate actions to slow the spread of this disease. Zone 1 and Zone 2, an area that spans from Sackville to Campobello Island, are now in the orange phase of recovery. To bring them back into the yellow phase and keep the rest of the province at that level, we need a renewed commitment to slowing the spread of COVID-19, and we need it now. Everyone needs to reduce their close contacts to the lowest number possible. I can assure you that the people who are transmitting COVID are not aware they're transmitting COVID. I can assure you that the people who are being infected with COVID-19 are not aware that they're being infected with COVID-19. It is a very subtle and very discouraging type of virus and transmission because it is silent. We don't know it's happening. But it is happening, and once it happens, it is very hard to get under control without the cooperation of everybody, every single citizen doing their part. Everyone needs to wear a mask when in public, even if you are 2 feet apart. Great, but you still have to wear your mask at all times. And don't think that you have an elevated level of safety by being closer than 2 feet apart while you're wearing a mask and not being susceptible to COVID. That's not true. Just because you have a mask on does not mean you can get closer to people. You have to observe physical distancing with others at all time, no matter where you are, no matter who you're with. Everyone needs to strictly isolate themselves when directed to do so. We can't go on as if our case numbers were still low. That's not possible. They are not low anymore, and there is a significant risk that they will climb higher in the days to come. And again, we have our triggers. We have our 3 categories of triggers. We have the epidemiological data in terms of the case number of transmission, of the type of transmission of cases, the number of cases, how fast they're increasing, whether there's community transmission or not. That's one of the categories. The other categories is the public health work in contact tracing. and the compliance and cooperation of the citizens responding and complying with public health measures. The other piece of this in terms of our triggers include the hospital capacity, hospital human resource capacity, as well as beds, and also the capacity to continue to provide healthcare services for the population. So we are looking at all of these triggers very, very carefully, and that is why we're in the orange phase of recovery right now in Zone 1 and in Zone 2.